Hey everybody, we're going to get started with assisting in minor surgeries. This is something that's commonly done in all types of clinics. Um, so we're going to talk about different types of surgeries, different types of equipment, ways to prepare, ways to clean, those kind of things. It's going to take us more than one session, so we're going to get started, okay? So what should you know when we finish this? Let me get my presenter to get working. You should be able to define the role of a medical assistant in assisting in minor surgical procedures. What procedures are performed in the doctor's setting, instrument used for minor surgeries, and describe what they do. Describe the procedures for medical and sterile asepsis in minor surgery. We need to be able to discuss the procedures used in a medical office to sterilize the instruments and equipment. Summarize the medical assistant's duty preoperatively and during the operation and postoperatively. Okay, so we're going to talk about minor surgical procedures. These are done in an ambulatory care setting or an office practice, for a doctor's practice. So what does the medical assistant do? There are different types of procedures that you help prepare for. Get all of the instruments and everything ready. You prepare the patient if you need to clean an area, if you need to drape an area, those kind of things. Then you assist the physician by handing equipment, keeping the patient calm, different kind of things. Also, you educate the patient on what to do after the procedure, and then ensure that surgical asepsis or surgical sterility is maintained. You help make sure that happens and make sure the equipment is cleaned properly after use. Administratively, if you are the only medical assistant in a small office, you may also have to help complete insurance information. You might have to obtain informed consent forms. You may have to contact the insurance company for prior authorization. You also may have to answer questions and explain the procedure before and after a patient has had a procedure done. So the things that you're going to do, you're going to prepare the equipment, you're going to prepare the room, you're going to assist during the procedure, and above all, you're going to ensure the safety and the comfort of the patient. So those will be your roles. Prepare the surgical room or the treatment room, prepare the equipment, assist during the procedure, and then ensure the patient's safety and comfort. Postoperatively, you may have to do wound care. You may have to assist the patient to get dressed, to get out to their vehicle. You have to educate the patient on how to relate. It may be related to diet, medications, activities that they may be able to perform, and then you have to make sure they have safe transportation home, and then you need to clean the room and get it ready for the next procedure. Things in a doctor's office of any kind go very rapidly. So you work consistently, constantly. You are constantly moving and working. So what is the medical assistant's responsibility in relation to to patient education and minor surgical procedures? What do you think you need to do? You need to educate them preoperatively, intraoperatively, and postoperatively, right? So you're going to explain the procedure, preoperatively, postoperatively, and then you're going to apply wound care if needed, and maybe even educate them on wound care. Surgeries in the physician's office. So minor surgical procedures are performed generally with local anesthetic, not general anesthesia. General anesthesia is, for the most part, performed in surgical centers and in hospitals. Reasons that you use local anesthesia: stitches, staples, diagnostic procedures like punch biopsies, or maybe even with some other kind of removal of a small growth or warts, things like that. Common surgical procedures require an incision, and an incision is whenever they take a scalpel and make a clean cut into an area. It could be for biopsy. It also could be for an IND or an incision and draining, where they open up a boil or a raised red area, and they will collect some of the pussy drainage to see if it has staph or something else in there. Generally, we drape that when we do an IND, when we drain an abscess, we will drape that so that it's just an open area that's cleaned really good. We numb it up with some lidocaine and with a local anesthetic. The physician will open that up, and lots of times the medical assistant is responsible for packing that wound and teaching on postoperative wound care. Sometimes it's relating to needing a needle biopsy or a punch biopsy. The removal of a small amount of tissue, and then you help prepare that to get it sent off to the pathologist to determine what it is. Is it just a mole? Is it just a discolored area of skin, or is it some type of cancer? They may do other kinds of biopsies in the office, and a needle aspiration biopsy. Mole removal, that's just removing a mole from the skin, and lots of times that is sent off for biopsy as well to make sure that it's just a normal mole, a benign area, not something that's malignant. Common surgical procedures that you have to do is to care for wounds. So people may come in with puncture wounds. Remember, if there's something poking in, the doctor's the only person that takes it out. Lacerations where they've fallen and cut themselves. Sometimes patients will come in with intentional wounds where they've attempted to harm themselves. Self-harm we have got to report. So what's our job? We clean the wound with soap and water generally for the most part, sometimes with Hibiclens if it's a really dirty wound. Irrigate with sterile water or sterile normal saline. And then sometimes we have to do debridement. So sometimes you put a debriding agent like debriding crystals or a debriding ointment, and then you may cover that wound. Sometimes you may help the physician with surgical debridement where they're actually taking a scalpel and cutting out dark eschar or dead tissue. And that can, like I said, can be surgical or chemical. Or mechanical, and you may do some mechanical debridement, and that's really getting in that wound and scrubbing out that yellow slough that gets in there into the wound bed. Autolytic generally is done by the physician. So wound healing, there are 3 phases, and there are factors that influence each one of those phases. Factors that influence all phases of wound healing are age. Really young and really old sometimes have trouble with wound healing, especially our really old. People who have a poor nutritional status, that they don't eat enough protein, enough zinc, enough vitamin C, those are very important for wound healing. And then people who have other disease processes like COPD, congestive heart failure, they have kidney problems, people that have hypertension, people that have diabetes, they all have a hard time with wound healing. So the first phase of wound healing happens at the time of injury, and that's the inflammatory response. When blood vessels constrict to try to help close off the bleeding so the wound can seal, or at least the edges of the open wound can seal. Then white blood cells come in and along with macrophages and help make that blood clot and make that kind of scabbed area or scabbing area. Also, it catches any other debris, can stop macrophages, help fight off bacterial infection, and help break those things down. So in the inflammatory phase is the first phase. The second phase is the proliferation phase, and that's when new tissue forms. And it's sped up if the wound edges are approximated. So approximated means they're pulled together or they're sealed. That's what approximated means, when the wound edges are sealed. So sometimes if someone has a laceration to the head, we clean it out, irrigate it really good, and we'll stitch it up. Sometimes we can't. Sometimes we have to let it heal secondary, where we want it to heal from the inside out. So we pack it to keep it from closing up too soon. Then the maturation phase, and that's where scar tissue forms. And in scar tissue, we really don't have nerves or new blood vessels. And it's not a resilient skin. It can break open if it's been a significant issue. Then, so maturation is the final phase. Common surgical procedures for closing wounds would be sutures or stitches. Ligatures, those are absorbable and non-absorbable sutures. That can, non-absorbable have to be removed. Absorbable are used a lot internally and in the mouth, and then in certain areas of the body. And then stapling. A lot of surgical wounds may be stapled. We do a lot of gluing now as well. Special minor surgical procedures may be laser surgery to remove less damaged skin from around the area of a wound, or to promote healing and to prevent infection. Laser procedures can also be done for removal of certain moles or hair or things like that. So what the medical assistant does in these procedures, they drape the patient to get them ready, sterile towels, cleaning it. They assist by handing instruments or medications or whatnot that might be needed. And then they clean up afterwards, clean the wound, apply dressing, and then give the patient instructions on the way out. Cryosurgery would be like with blisters or with warts. They do cryosurgery, freezing it. They use, my brain just went blank. It's extreme cold, generally applied as a chemical to destroy unwanted tissue. It can be done with moles, warts, and other kinds of skin tags. The patient does need to be educated that blisters may form and not to burst them, and that ice packs and Tylenol or ibuprofen generally relieve that pain. So we're going to educate the patient. Also, sometimes they want a dressing kept over it for a couple days. We tell them not to remove it. Just whatever the doctor has ordered related to that. Electrocauterization sometimes is done with a needle or a probe or a heat loop, where an electrical current will be placed on a specific tissue to stop growth or to stop bleeding. It requires a ground plate and a pad. These are generally in dermatologist offices, seen most often in dermatologist office. And then we're going to give them general wound care directions. Keep it clean and dry, keep it covered, those kind of things. So let's see what you know. A 65-year-old female has a wound on her left calf that is healing poorly. When reviewing her chart, what condition would you look for that would indicate a reason for poor healing? Well, I can think of a couple. Besides her age, we would want to look at her nutritional status. We would want to see if she has congestive heart failure, diabetes, any of those kind of things. Obesity, if she's a smoker. So those are common things that we would see. Okay, so we're going to talk about a few instruments. There are different kinds of scalpels, scissors, and curettes. What we're looking at here are all different types of scissors. I will ask you some of these types of scissors, and they're needed for different things. Sharp scissors lots of times are needed in debridement. Blunt scissors are needed sometimes in wound therapy. And there'll be a sharp on one end and blunt on the other side, sharp, blunt. They may use that to remove dressings, sharp on one side and blunt on the other. Blunts, lots of times we use blunts for just cutting things in the office, cutting dressings, cutting a hole in a drape. That way we're not going to injure the patient. Blunt curved. So as you can see, one side is blunt, the other side is curved out even more. Then you have the curved sharp with a blunt edge. Lister bandage scissors, those are used most often to remove bandages because they'll lift and cut and never touch the patient. Spencer scissors, those are what we remove sutures with. As you can see, they have that little hook on one end and they're blunt on the other. That way you can pick up the suture or the stitches and snip them and then pull them out with forceps so that you can pull those out. So those are the different types of scissors that can be found in a doctor's office. What you're seeing now is various types of curettes. Curettes have a small loop on the end, and there's different size loops. The different size loops determine kind of what they're used for. Some are for nasal, some are for ear, and some are for some different types of procedures. And go back. Scalpels, and it doesn't show scalpels, but scalpels are what we use to make an incision. And I'll show you guys some scalpels a little later. Okay, we're going to look at hemostats. There are curved, Addison. There are normal that look like a set of tweezers you're comfortable with. That what we call those hemostats. There are different kinds. They're for grasping hemostats, and then there's holding hemostats. So we use them for different aspects. Some have Addisons have a thick grip for the thumb and the forefinger. You have some that are the Cushings that are the curved ones. You have some that are for teeth to help extract teeth and tissue out of the mouth. And then on the bottom are the forceps that we think most often for holding things. And they will clamp together. And we use different types for dressing changes to hold sponge forceps or different Judd Alice's are for teeth. They're more oral related, and then we have our holding forceps that can be curved or straight. And when you clamp them together, they hold that in place. So these are some other kinds of Kelly hemostats, Creel hemostats. So your forceps at the top, hemostats on the bottom, and then you have your curved, your Rochesters, and those have a almost like a grid all the way down. Bacchus, or you can have long and short Bacchus clamps. They are generally used for towels, as a towel clamp to hold surgical towels in place and other surgical sheeting in place. And then you have Jones clamps. Okay, retracting, dilating, and probing. So what you're seeing first are retractors. Retractors are used to pull skin back. So I want you to remember that retractors are used to pull skin back. The two you need to remember most are the Sin Miller, and as you can tell, they have kind of look like a bent fork on one end, and then at the opposite end, it will have what looks like a little foot on the end. That's a Sin Miller. And then the Murphy forceps, which will have a loop grip on the bottom and will look like a bent fork on the other end. And those are retractors are used to pull skin away, to hold it back. Now we have dilators. The Pratt urine dilator, that's used to dilate the urethra. There's the balloon dilator, the curved dilator, and then the Wilder lacrimal dilator, and that is for the lacrimal duct in the eye to help dilate that when it has become clogged. Different types of probes. I want you to remember that there are multiple types of probes. Probes are used to go into different areas, sometimes to help pull up some tissue, sometimes to help hold tissue down in place. And then we have multiple types of needles, and then we're going to stop there for today. We have straight needles, compound curved needles. So if you look on their axis, they have a little over on that axis. They will go they have a compounded curve. Then you have your half curve, and it will look more like a J loop or a small J. You have your 3/8 circle, your 4 circle, your half circle, which is used for most common for suturing, and your 5/8 circle. Your doctor is going to have preference on what kind. I've not worked with a doctor that used the straight sutures. Most common, the half and the 5/8 are what I've had physicians work as far as suturing instruments. Needle holders can be they can be they're a type of forceps that will clamp that needle as they are stitching through. Okay, so we're going to talk about syringes with needles tomorrow. You guys have a great day, and I'll be back with you soon. Thanks, everyone.